Hi, my name is Faith, and my group mates Josh and Lolly, we decided to choose Parkinson's disease for our nervous system project. What is Parkinson's disease? It's a neurodegenerative disorder of the central nervous system that affects part of the body controlled by the nerves. It affects predominantly the dopamine-producing neurons within the substantia nigra, and it can lead to altered motor movements. Although most people with PD first develop the disease after 60, about 5 to 10% experience onset symptoms before the age of 50, and nearly 90,000 people in the US are diagnosed with PD each year.
The symptoms for PD might start off mild, but they will gradually become more severe over time. PD has four main symptoms. Someone affected with PD will have tremors in their hands, legs, and head, as well as slowness of body movement, stiffness in muscles, and they will have impaired balance and coordination.
Unfortunately, there is no definitive test that can be done to determine whether or not someone has Parkinson's disease. However, instead, it is diagnosed clinically by a doctor. Unfortunately, there is no cure for Parkinson's disease. However, there are treatments to try and reduce the symptoms. The first one of these treatments is through drug therapy, primarily using levodopa. This causes the nerve cells to create more dopamine, which helps ease symptoms. The next method is through surgery. By removing or destroying small portions of the brain, symptoms can also be reduced. Deep brain stimulation has also been shown to reduce symptoms by placing electrodes that stimulate the brain to reduce the uncontrolled movements seen in patients. There are also other therapies such as physical therapy, occupational, speech, and others that tend to reduce symptoms in patients.
You can see with the image on the right from visible body, it has the basal ganglia highlighted in blue. This is the region of the brain that PD impacts. It greatly impacts the basal ganglia as well as the nerve cells and causes them to deteriorate. When less dopamine is being released, there is less communication between those nerve cells and the basal ganglia. Because the basal ganglia controls movement in the body, the loss of those connections directly relates back to the motor symptoms someone with PD would show, like tremors and trouble walking.
So now looking at how Parkinson's disease impacts the white and gray matter in patients. Gray matter tends to atrophy in patients, and white matter tend to form lesions. Both of these can contribute to the cognitive decline and motor problems seen as symptoms. However, overall, there tends to be a reduction in both the white and gray matter in the brain of patients in multiple regions, as listed on the slide here. Now looking into the different types of neuroglia that are impacted by Parkinson's disease. Primarily, from what we found during research, the microglia and astrocytes were the ones that were affected the most. The loss of their homeostatic functions and the gaining of neurotoxic functions tend to lead to the symptoms seen in Parkinson's disease in some studies. Parkinson's disease associated genes will also express in glial cells as well as neurons, which have crucial roles in the microglia and astrocytes of patients. This suggests that we should increase our understanding of the role these glial cells have in Parkinson's disease, which may lead to better treatment in the future by targeting these neuroglia. Now looking into how the meninges impacts Parkinson's disease. The meningeal lymphatic system tends to have issues clearing or is unable to clear in patients with Parkinson's disease. This tends to be, or has been found to be, a very significant factor onto the onset and development of Parkinson's disease.
While Parkinson's disease mainly affects the central nervous system, it can also impact the peripheral nervous system. The non-motor symptoms, like low blood pressure and urination issues, are shown to be present because of the signals sent by autonomic nerves. Additionally, the motor symptoms, like impaired balance and slow movement, are shown to be present because of the signals sent by the motor nerves. Regarding neuroglia of the PNS, it is not impacted in any way since it primarily affects the central nervous system.
Now talking about if Parkinson's disease impacts the functions of target organs of the autonomic nervous system. And yes, dysfunction of the autonomic nervous system afflicts most patients with PD. Some examples include orthostatic hypotension, gastrointestinal issues, as well as urinary dysfunction or bladder issues. Here are our works cited. Thank you for watching.